Hello everyone, my name is Darius Ford and I'm recording this for my CRM 715 capstone course. I'm very excited to share my targeted literature review and my findings with you guys on the topic of pain management in sickle cell patients and how that might lead to opioid addiction. Sickle cell disease is a blood disorder that commonly leads to chronic pain, infection, and other serious health problems. This is obviously an issue since sickle cell disorder, pretty much all of the symptoms lead to either acute or chronic pain. And this goes into how we manage that acute and chronic pain, as it is a lifelong disorder that gets worse as we age. So it is a rare disease in the US, but is amongst one of the most common rare diseases in the US. So although it is rare, it is very common amongst the rare diseases. And as I just stated before, acute and chronic pain is commonly treated with opioids, especially within the sickle cell disease population. Okay, so long-term opioid use is one of the main issues with sickle cell disease. So you're wondering why I chose this topic, not only because of my friends and family that are suffering from this, but also there is a need for alternative methods with pain management in general, especially when it comes to chronic and acute pain. So that long-term opioid use among sickle cell disease patients may lead to opioid misuse, abuse, and addiction. So you see here, I have this graph that shows us the opioid epidemic that we've been experiencing since the 90s. And I am willing to bet that within this yellow area of the picture, you might find some sickle cell disease patients that are also affected by the opioid epidemic. Okay, so let's take a deep dive. So the targeted literature review was conducted to further support the initial research question. And my initial research question is, in sickle cell patients, are the use of opioids for chronic pain management associated with downstream elevated risks of opioid addiction? And to take that a step further, what type of health implications does opioid use within the sickle cell population have on their long-term health? So what I did, I chose 5 initial pieces of literature to review, and those findings were very mixed, but they further support the need for more research. So the first piece of literature here is titled Outcomes of Multidisciplinary Team Interventions in the Management of Sickle Cell Disease Patients with Opioid Use Disorders. This was a retrospective cohort study that targeted 21 sickle cell disease patients aged 14 and up. Data was collected between 2016 and 2018. So this is a very interesting piece of literature that I found very useful. This was probably the most specific piece of literature that I found at the time of my targeted literature review. So that is one thing that I took away from this. However, the sample size is extremely small at 21. And so this is one of the limits of this piece of literature. And also this piece of literature, they wanted to target these 21 patients that might potentially have opioid use disorder, in which they were confirmed to have it, but they did not want to offer alternative pain management methods. Rather, they would want to manage their opioid therapy better. And I think that that is a part of the issue and why we need more research. So the next piece of literature is the Prescription Opioid Misuse Index in sickle cell patients. It's a brief questionnaire to assess at risk for opioid abuse. This piece of literature was extremely interesting as well because it targets something that I didn't even think about to begin with, is how do we even know if the sickle cell disease patient might have issues with opioid abuse? So that is what this was for, and I think that's one of the main positives from this. However, the sample size again is a bit small, and there is more research needed with a bigger sample size for more power for our trials. And we see here at the last statistic, 24% within this 99 sample size were identified as at risk for opioid misuse. And that lets me know that we need to do more research because I would think that within the full population of sickle cell disease patients, we might find a little bit more too. And that is a high number compared to some of the numbers within most of the other disease categories that are treated with opioids. So the next article here is one that I criticized quite strongly, and this was the pharmacogenetics for safe codeine use in sickle cell disease. At first glance, this was one that was presented as an alternative trial when I did my targeted literature review. However, this was not that. This is a preemptive pharmacogenetic testing implementation approach to safely maintain codeine as an option for pain control. So again, we see this theme of wanting to maintain or manage opioid use better rather than eliminate this or provide alternative methods that are non-opioid treatments. So within this piece of literature, there was no mention of alternative methods, and there was no mention of risks surrounding opioid therapy at all, which I think is an issue, and that is to be further examined and discussed within my targeted literature summary. The second to last piece of articles that I found is titled Alternatives to Opioids in Pharmacologic Management of Chronic Pain Syndromes, a narrative review. And so this is a narrative research review similar to what we're doing here. But I wanted to use this to really help summarize what I found as well. There are a lot of trials that have tried to find non-opioid methods, so they say, but those turned out to not be specific as far as how my research went as well. So we are really aligned there. There was 271 that met inclusion. However, their evidence showed that non-opioid methods are effective, but those trials were all poorly designed and they lacked population size to show statistical significance. And then one of the main takeaways from this article that I found very interesting was that pain research in the US is well underfunded, not just for sickle cell disease patients, but just in general. So I think that was very interesting, that something that is a major moneymaker within the US is extremely underfunded. And with the implication on opioid abuse and addiction, you would think that we would like to find other methods as opposed to opioid pain management. So that is something that I found very interesting from this article, although it might not be relevant to the targeted literature review since it is a narrative research review. And finally, we have the article that I was perhaps most perplexed on. So this is titled Key Components of Pain Management for Children and Adults with Sickle Cell Disease. So this was a review of the therapeutic window surrounding optimal pain control using opioids. Originally, this was one of the top hits that I got within my opioid addiction and sickle cell disease patients and alternative methods key searches. And I was quite disappointed. As you see here, it was a promising review, but within this article or within this review or study, there was no mention of opioid addiction at all. And I think that that is quite odd given the graph that I actually took from this article here. So they want to use a biological, psychological, and sociological method to better help manage opioid therapy within sickle cell disease patients. And I just want to touch here on this bottom part. You see it's psychological, right? And that might lead to acute pain or chronic pain or acute and chronic pain, right? And within this psychological bubble, you'll see depression, anxiety, learned helplessness, and sleep disorders. So these are all things that are closely aligned to opioid addiction as well. The FDA and the CDC does confirm that a lot of those who do have opioid use disorders suffer from these same psychological issues. So I found it quite odd that this article did not mention opioid addiction at all when we are trying to see the key components of pain management for children and adults with sickle cell disease. So the key takeaways from my targeted literature review is most of the trials that I found were observational with very small population sizes. That might be due to the fact that this is a rare disease. All pieces of the literature mentioned the use of pain scoring, which I'm glad I'm touching on that now. So sickle cell disease patients, when they go to the ER, they give a pain score, which is very subjective. And so this might be related to opioid abuse and misuse as well, since patients are scoring themselves, but there is a sophisticated system, but it's not consistent across hospital systems. And this may lead to over opioid treatment therapies prescribed to sickle cell disease patients. So this leads me to feeling that we need more research on opioid abuse in sickle cell patients. And the final objective of this for me and for those that I work with is to find safer alternative to opioid therapy in sickle cell disease patients, i.e. alternative methods that are non-opioid. So we've made it to the end of the presentation, and I hope that you guys have enjoyed it. But just one last piece here, we do have the supplemental targeted literature provided by Professor Cook on the subject, and I found this extremely helpful, so this will be submitted with my targeted literature summary. I would read it all word for word for you guys, but we've run out of time. So I hope you guys enjoyed, and I hope you learned something from this review. Thank you.